Wait, so what are we talking about again?
Jose, let's dive into the pelvis.
Okay, that sounds fun.
Did you know that pelvis means basin or bowl?
I can see why they called it that. Yeah, definitely. There's some.
Let's explore the depths.
Let's go. Well, to do that, we're going to put on some gloves. I brought some gloves. Yeah, I brought some gloves for fun.
I don't know, Jose. I just want to point out those are mismatched. You got a green and a purple. Is that part of the plan?
Guess what it is?
Okay.
So I was in an anatomy lab, and I happened to accidentally mismatch my gloves, and it worked out.
Not an accident.
Okay, maybe it wasn't, but it worked out. So here we go. So I hope this helps. So hey, everybody, welcome. Congrats. I hope that your studying is going well. So I'm going to help you. Hopefully, I know this is going to help me, so I hope it helps you. This is going to be our roots. Okay, nerve roots. We're talking.
Okay, so roots of the spinal nerves?
Right.
Potentially sacral spinal nerves?
Potentially, right?
Okay,
Well,
okay.
So in this case, my thumb is different from the rest of my roots, right? So I'm going to call these S1 through 4.
Okay.
Okay. And the lumbosacral, I like to think of it as since it's at the bottom of the lumbar and it's before the sacrum.
I'm thinking thumbro-sacral.
Yeah, thumbro-sacral. Okay, anatomy bro. Let's go. So we got our thumbro-sacral here. Our lumbosacral. And we've got S1 through 4. All right. So if everyone's with me so far, hopefully you can still follow along and you can see what I'm doing. My next hand, vessels.
Okay.
So we're going to do some intertwining of both the nerve roots and the vessels. And it's going to be kind of hard to see from this angle, but we're going to do our best. If you can follow along, my arm is going to be the trunk. And then these are the branches, all the little tributaries.
Of like the internal iliac?
Right.
Yeah, okay.
So we're coming abdominal aorta, common iliac, internal iliac.
Okay.
And then now we've got all of this happening, this mismatch.
Right on.
So let me scoot over.
Yep.
See if this helps. So if this is the plane that we're looking at, okay, and here is the rest of the vessels, typically in these anatomy drawings, I tend to see this pattern. And then we'll explain the differences and like what actually defines superior versus inferior. But if we're coming in, and I do this with my hand. And let me do it for you. So I do this. My pinky is going to be going up to the lumbar region, iliolumbar.
There you go. Yeah.
Okay. This finger that's going laterally across the sacral roots, S1 through 4, is going to be our lateral sacral. It's going laterally. It's going across S2 through 4 in this case. Okay. And these are typical anatomical drawings that I tend to see. You can correct me if I'm wrong. So iliolumbar, going up to the lumbar, lateral sacral, okay, my ring finger, going laterally across the sacral roots, and then between lumbosacral, okay, my thumb, and my first finger, this finger here, when I'm wiggling, is going to be superior gluteal artery.
Yeah, it's going in between the lumbosacral trunk and S1 spinal nerve.
Yes.
That's what a superior gluteal artery
We
often
tend
does.
to see that. And in some of the anatomical drawings, they also include between S1 and S2, my middle finger, being the inferior gluteal. Now, sometimes it goes over here, it goes in different places, but to define it, it's the relationship to the piriformis. Okay, but for the visualization, for this like mnemonic to work, I just did it as I've seen it in the anatomical drawings. And again, these are the nerve roots, these are the vessels, and we're coming in, we have iliolumbar going up to the lumbar, lateral sacral going laterally across the sacral roots, between lumbosacral and S1, superior, and between S1 and S2, I just put my inferior there. It's a placeholder. We'll talk about what actually defines superior versus inferior gluteal arteries. Okay. But this kind of looks like the representation that we see in a lot of the diagrams.
I love it. I love the use of the 3D not kinematic. What's the word? Kinesthetic. Approach to representing these structures with your own body. I have one question and one objection. The question is, was that the right side of the pelvis or the left side of the pelvis?
Oh, that's a good point. In this case, we're talking left side.
Okay, that's what I thought.
Yeah.
And then the lateral sacral artery is named lateral sacral, which when I first looked in the pelvis, I was looking for this thing heading laterally. It actually heads medially. So it's the lateral sacral artery that directs that comes often off the posterior division of the internal iliac, and then heads medially toward the midline, and then its branches approach and then enter the anterior sacral foramina on that side. So it's the lateral sacral artery moving from lateral to medial.
So it's actually moving lateral to medial.
Yeah.
Wow.
Yeah.
Interesting how that works, because the way I see it in my mind, how it's coming from, if we're thinking abdominal aorta, common iliac, internal iliac, and then it looks like it's an offshoot off the internal iliac that's going laterally, at least in my mind when I saw that.
Well, so iliolumbar is directed, it does like a 180. So if you're thinking about it on the left side, and I'll imagine this is the pelvis, and here's our left internal iliac, the posterior division, if we have a discernible posterior division, the iliolumbar tends to go a little bit laterally, curls up, does a 180, and it's got a branch, iliolumbar, there's a branch that goes toward the iliac fossa, and a branch that goes straight up toward the lumbar vertebrae.
Makes sense.
But the lateral sacral should be pointing basically the opposite way, toward the midline, and where the anterior sacral foramina are pretty close to the midline, the artery's got to come off the internal iliac and head that way.
So why didn't they just call it the medial sacral?
I am kind of a little, I kind of want to go back in time. My time machine is not complete yet, but I have a couple of issues with the ancient anatomists.
Sure.
And this is not the top of my list, but it's on my list. Like lateral sacral, really kind of confusing.
Yeah.
Like can we talk about
but
this?
for my mnemonic, it works, right? Because you can draw it and you can go laterally.
Show us again.
Yeah.
Show us again. Show us.
So if you look again, this is my lateral sacral, and it's if we're coming down, and this being, my thumb being the lumbosacral.
Lumbosacral. S1 spinal nerve.
S1, and then these are the S2 through 4 sacral roots, and we're traveling.
You had your iliolumbar. This is the pinky, right?
Yeah, pinky.
Iliolumbar is doing a U-turn, going up. Love it.
And then lateral sacral.
Lateral sacral.
Crosses over in the lateral plane or whatever.
It comes from lateral to medial, but and that lateral sacral will have many individual branches.
Yes.
It's more than one thing. It's like 1, 2, 3, and they're heading toward those anterior sacral foramina. So they have to run across the nerves to get the nerves are coming out laterally.
Right.
And the branches of the artery, if you follow the flow of blood, are going, they're directing the blood medially, so they have to cross, and they do cross over them.
Sure.
Yeah, exactly.
So hope that helps. And then for the rest of it, at least for we're responsible for in this anatomy lab. I know there's so many additional little tributaries, but
I mean it's only like 100 bolt terms or whatever it was.
Sure, only 100, right?
It's crazy.
What is that, breakfast for you? You're like, okay, I'm gonna just.
No. I mean it's way more. This particular lab where you just created this novel mnemonic is kind of it's light on dissection, but then the students look at prosected, dissected in advance for demonstration.
By professionals, right?
By professionals? I often explain the term as dissection by professionals. Well,
are they really? Are those first and second year medicine professionals? Not yet, no.
So anyway, so the students that we met with in lab just this morning, were looking at prosections and trying to identify a large number of bolt terms, including these vexing, difficult to identify, challenging branches of the internal iliac and the spine. I did have one student say to me, "So wait, it's not just sacral spinal nerves. We have to know the number." Of the student.
Yes,
I'm like, yes, you do. And here's how you find out.
Yeah, there you go.
Right?
Keeps it all together.
It was a nice segue. Yeah, no, it all worked out.
But we forgot about my thumb, though, right? So when I did my little...
Oh, I thought your thumb was just...
Right?
So there's the lumbosacral thumb, the other thumb.
Yeah, so this thumb here going out for the anterior.
Oh, the anterior division.
And in the anterior division...
I'm going to have to...
I know.
You have to twist
I think when you do it yourself, it's better than me trying to show it to you, but I hope you get the point. And if not, I'm happy to go over it in person. But now we've gone off in the anterior division, and we're going anteriorly.
Okay.
The first offshoot.
Counting from like the sort of most forward, the most anterior, and then working my way backward. I look for the umbilical artery
right,
first.
Umbilical artery.
Yeah.
And then the obturator travels with the obturator nerve through the obturator canal.
Yes.
So it must be the obturator artery.
If it's there, 80%, you find it there. 20%, it's a branch off the external iliac. So, and then there's a couple of prosections that have that.
Okay.
1/5 of them, roughly. So, so that's a variable one. Variability is the rule rather than the exception with the internal iliac. But so I do look for umbilical first, then obturator, then what's next?
And then we've got one more.
Not
one more. It's a bunch of little branches that they're responsible for in the bolt term. It sits superior to
the bladder.
The bladder.
Yeah, so those are branches off the umbilical where it's still patent up to the last superior vesical.
Yeah. And you've got a bunch of them usually right on the top of the bladder.
That's right. Yeah. There should be typically there's a couple of them, and then after that, the next one I'm looking for depends on the sex. If it's a female, hemisection pelvis, I'm looking for the uterine artery. If it's a male, it may be time to track down the inferior vesicle, which we don't actually have them do. That's not a bold term for this line.
That's a bit intensive. But talking on nerves, I remember another one I came up with too.
Another mnemonic?
Another mnemonic, quick one. So
tell us. Let's hear it.
Pudendal nerve.
Yes.
Okay. Controls the external sphincter.
Yes.
Allows you to
external anal sphincter and urethra. Yeah.
Yeah, and allows you to poo. It's the pudendal.
Okay.
You control your ability to release the poo at least.
Can I follow up with a mnemonic based in etymology?
Okay.
The pudendal nerve, as I learned to pronounce it, pudendal nerve. The root term comes from the Latin pudere, which means shame.
Poo there, and if you poo there, you shamed yourself.
Pudere.
Yeah.
So I believe the name was coined and published around Victorian era, London, Victorian England-esque has that kind of timing, and so it was the artery and the nerve, the pudendal nerve, the internal pudendal artery, the shameful nerve. To the shameful region that we don't talk, the perineum.
Yeah, we're not supposed to talk about it.
I don't talk about it.
Okay.
Yeah. Well, now we do.
We might have.
We're talking about it right now.
We might have to cut that part out of the video.
Yeah. You get shut down by the algorithm or whatever. Like.
No, by the 17th or 16th century Victorian elders that build a time machine into the future.
That are
and
literally.
Are going to say, why did you say that?
They got the steam-driven, video. They're checking the YouTube videos for pudendal stuff, perineal stuff. Just one more thing. Is that any more mnemonics?
I came up with one, but it was very basic.
Okay.
It was just because we went over the kidney and we opened it up and we looked at the beautiful specimen that is the kidney.
Right.
And
calyces.
Yeah, when we looked it up, I was like, wow, this is great. And it kind of reminds me of a few things. Like, for example, the cortex layer being kind of like the brain, being like the outer part. Mm-hmm. And the medulla being the middle part, right? That makes sense.
Mm-hmm. Yeah, cortex and bark and core. Yeah.
Right.
Yeah.
And then the components inside. Okay. So you've got to hold up the cortex. I think of it as like a roof. We're holding it up with these pale divisions in between.
The pillars? The
columns.
The renal
the renal columns hold up the cortex.
Oh my God.
And then you've got a triangular structure in between. It looks somewhat triangular.
Oh, yeah.
Then we can think in 3D. What's 3D triangle?
A three-dimensional triangle. I'm going to go ahead and say a cone. No.
Yeah,
square with a square base. A pyramid.
Yeah. So they call those the renal pyramids.
Right on.
And then from the pyramid...
They're upside down, but okay.
Yeah, right? Yeah. And from the pyramid, we go through this opening, the papilla.
Drip. The papilla is the nipple or mound at the tip of the pyramid where the urine drips into the...
So all of that helps you PP, right? So
PP.
Pyramid papilla.
Papilla.
Yeah, so PP.
Okay.
CC, P. Now the two C's are the minor calyces.
Oh my God.
The major calyx, which collects from multiple minor calyces.
Yep. And
then you end at the pelvis.
At the renal pelvis.
So then we've got PPCCP.
PPCCP.
And then you can pee for free.
PP.
You can let your pee free. How about that?
That is genius. I love it.
Okay. Thank you. Thank
you. We just there's only one problem.
Oh.
We need to get you a red glove.
Oh, that would work. And maybe a yelloe one or an
off-white. I think green's
off-white for that.
I think that color is like it's a pale color.
Yeah.
And sometimes I've seen nerves represented. They're usually yellow. Yeah, they're usually drawn yellow. We need a yellow glove and a red glove.
Okay.
Yeah.
For the next one.
Yeah.
Red glove, yellow glove.
Yeah, and get the framing so that you can just get right in there. Yeah.
You can just zoom in.
Yeah.
Yeah. Cool.
Okay.
Awesome. That was fun. Anything you want to share? Drop for the kids at home or.
I think pelvis wise, I think there's a lot of good stuff. Yeah.
Okay.
I'm gonna stop it there. Yeah. Yeah. Cool. Thanks.
Good luck. You got this.
Okay, Jose, we're coming back for an addendum. We've read something we forgot, something critical.
Yeah.
But I'm trying to get the framing right, and I'm just like, why are you?
Oh, I look short, huh? I look like the inferior gluteal artery here. Okay, so that's actually what we're going to talk about.
Yeah, the gluteal arteries.
We glanced right over it, but let's not forget. How do we define superior versus inferior gluteal arteries? That relationship is helpful. Mm-hmm. What I did with my gloves earlier. Mm-hmm. Helpful for us to understand, like superior comes first and then inferior. But what truly defines
as we go along the internal from top to bottom, yeah.
Yes. Yeah. And as we're going along, that helps me see it, and at least I can see it that way. But that's not always the case where you have superior gluteal going in between the lumbosacral and S1. That is true, but then this part, the inferior gluteal artery doesn't always go between S1 and S2.
Sometimes it goes S2, S3.
Right. So
how are we going to know? What is the ultimate defining characteristic that we can use to determine, yes, this is superior gluteal and this is inferior gluteal?
I don't know why the name piriformis.
Piriformis.
Pear, you know?
Shaped like a pear.
That one.
Uh-huh.
That one rings a bell. That one feels like it's the muscle that defines superior and inferior gluteal artery for me in my mind.
That is literal. That is
that
exactly
really it?
Yeah, you go around to the other side. You leave the pelvis. You go around to the gluteal region. You reflect gluteus maximus, and the neurovascular bundle coming out above piriformis is the superior gluteal neurovascular bundle, and the one coming out below it is the inferior gluteal neurovascular bundle.
Oh, man, so things from MS from my first year of med school still stuck in there somewhere.
Have you ever heard someone refer to something getting pear-shaped, or it goes pear-shaped on you? Have you ever heard that phrase?
I have never. Oh, piriformed.
Well, they don't say that. They got all maybe it's like years old. It got pear shaped. It's kind of like saying going south, like this went south, right?
Okay.
And it's kind of like things went badly.
This is making me paranoid.
Paranoid.
That sounds bad too.
It's making me pira-righteous. I see people pear shaped. I'm like, pear shaped. Piriformis means pear shaped. It's a perfectly good muscle.
Yeah.
There's nothing bad about it.
There's nothing bad about it.
It's the keystone muscle of the gluteal region and helps us figure out which one's superior gluteal artery and which one's the inferior.
Makes sense.
I mean, here's one more thing about piriformis, because I know you haven't heard enough.
No, we have not heard enough. There's still some stuff forming in my mind.
When you look at the actual muscle, I mean, what I've seen in our embalmed donors is basically like this. Piriformis, if you were looking from into the pelvis, anterior view at the left side, right? You would see piriformis projecting out. You can imagine it projecting out like that. And it's basically a skinny triangle, and then you'd have your, you can barely see, but then you'd have your inferior gluteal neurovascular bundle emerging, exiting the pelvis underneath, the superior gluteal neurovascular bundle exiting above it. But basically, it's a skinny triangle, which makes me wonder, like when they named this muscle, 1,500 years ago or whatever, were the pairs like this? They were just skinny little triangles, because now they're like all rounded at the bottom. Doesn't really.
You know what I think? What about when you finish the pear, like the core? Maybe the core of the pear looks like a piriformis.
Piriformis, the form of the shape of the eaten pear.
Yeah,
that's right.
There you go.
Yeah.
Well, I mean, what else did you do?
They thinned it out.
Isn't that what they were doing in the anatomy lab back in the days? Had a pear.
We frown on eating in the lab now, but I think there are some people who did it back in down in the catacombs when they got hungry.
That's probably what happened.
Yeah, they were down there for days at a time,
solving the anatomical mysteries, one pair at a time.
We really need that time machine.
Yeah.
All right.
Eventually, we'll figure it out.
That was great.
Great. Thank you.